joined the meeting.
So please mute your audio. You can take a picture of this slide right now and note where you can email questions, or using your chat box function, you can send to Fiona Gupta any questions you have on this. We will try to answer as many as we can after this presentation. You can also follow us on social media with the following areas. And okay, we will start the presentation now. Okay. Let's see here. So allow me to introduce myself. My name, what is, somebody seems to be drawing on the screen. Give me a moment. Okay. So my name is Dr. Brian Kopell. I'm a neurosurgeon at the Mount Sinai Health System. I am a neurosurgeon whose practice is focused on movement disorders. I also have a secondary certification in anti-aging medicine, which is going to be relevant to our topic today. Fiona, would you like to unmute yourself?
Yes, thank you. My name is Dr. Fiona Gupta. I am a neurologist and a movement disorder specialist at Mount Sinai. It's really amazing that so many of you have joined us today, and hopefully we can really delve into wellness, particularly amongst what we're dealing with COVID, and how we can come out of this together and stronger and smarter. So thank you.
It'd be very, also during this presentation, please do not share your screen in any way. It's really a sort of passive process. The only function I'd like you to use is the chat function, so it doesn't disrupt the flow of things going on. Okay, great. So the first part of today's presentation is going to be how to optimize your health during the you can't see your slides. Okay. 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 So sorry about that. Zoom is a slightly new thing for me, and I'm doing my best to make this happen. So the first part of my presentation is going to be talking about how to optimize your health during the COVID-19 crisis. Some of it will touch upon specific movement disorder related issues, but the truth of the matter is optimizing your health during this crisis is something relevant to movement disorder patients and your families alike. So whatever you see here is going to be applicable to everybody. Dr. Gupta afterwards will discuss certain considerations for Parkinson's disease, dystonia, essential tremor, as well as deep brain stimulation and telemedicine during this time. And then lastly, we will discuss questions and answers that you have sent in. Best thing to do now is grab a pen and paper. You are muted. Please do not use any of your share functions. Send your questions again to movementquestions2020@gmail.com. If you're on an iPhone, you may disconnect it if you try to take a picture. Just note that. We will upload this presentation in an edited form later on Facebook as well as YouTube. You can follow us at Facebook, Mount Sinai Center for Neuromodulation and Movement and Mount Sinai Movement Disorders, as well as our YouTube page, Mount Sinai Center for Neuromodulation. So my talk, or my section of today's talk, is going to be called On Engineering COVID-19. And I'm going to explain a little bit about what I mean by engineering COVID-19. Please note, obviously in this day and age, I have to, just give a bit of warning. Any advice in this presentation is suggestion only. We cannot make official medical recommendations or prescriptions in this forum. Just please note that. This is an educational, not a prescriptive forum. So, one of the things that sort of occurred to me over the last several days is how inundated we are with, terrible news with the 24-hour news cycle. And clearly this is an extremely severe crisis, probably the most severe crisis that has happened in generations. But nonetheless, people have responded well. We as a society are beginning to respond well. And there is some emerging, if you will, good news or mitigating news that is happening as a result of everybody's behavior. Despite the numbers that are being presented on the news, and the numbers are going to get worse as we go through this crisis for the next several weeks, there are some numbers that you do have to keep in mind in context so that you can interpret what's going to be bombarding you. 80% of every human being that gets this virus is either going to have a mild cold-like symptoms, or they may be outright asymptomatic. It's extremely important that you keep that figure in mind. And only 12 to 15% are likely to require some hospital intervention. And only about 5% of those are life-threatening. So only about 5 or 6% are in the life-threatening category of this disease. It's important to remember that as these numbers are going to grow to very, very large numbers. And yes, the COVID-19 virus is directly related to age in terms of its risk. And we've seen this now, that most ICU admissions and deaths are in the greater than 65 age group, and this is according to the CDC. However, if you actually look at who is actually dying and who is in the ICU, the vast majority of these patients have multiple comorbidities, most importantly hypertension, followed by diabetes, heart disease, and chronic lung disease. For instance, Parkinson's disease is not as of yet recognized as a comorbidity that increases your risk, although we will talk about things that might affect the disease. I want you to all think about that, because there are so many news reports, and it will be, of young people, no comorbidities, that die from this disease, but these are statistical, outliers. It's something that makes good news copy, but it's not reflective of the reality overall of this disease. And it's important to remember that. There's a lot of panic and fear going on. Panic and fear is perhaps the most deadly thing that we are facing right now. And hopefully today I will be able to give you something that will reduce that panic and fear. More emerging good news. There appears that there may be some flattening of the case number curve in the US based on what we are doing in terms of isolating, going into these pseudo quarantine type of scenarios, closing businesses, etc. So whatever we are doing, listen to your public health counselors, because guess what? What we're doing is having an effect already. So please continue to do this. This is not a cause to then lighten up. It means that what we're doing has an effect already, and that should make people feel a little bit better. The other thing, despite the fact that the caseload continues to rise exponentially, the death rate from COVID in the US is far below in a trajectory fashion from the worst countries of Italy and Spain, despite a similar case number trajectory. In fact, our death rate currently is around a little over 1%. And in general, it's very similar to Korea's and Germany's at this point. And this is despite the fact that we are actually testing less than these other countries such as Korea, Switzerland, Germany, and even Italy and Spain, in the sense that we have less access to tests. So the case numbers will continue to grow, but the death rate is likely to continue to stabilize as long as our healthcare system can keep up with the number of cases. So again, that is a small piece of positive news that is currently happening. So let's talk about some strategies to kind of bolster yourself during this crisis. One concept that I want to bring to everybody's attention is this concept of inflammation. Inflammation is a force that is one of the fundamental drivers of all the diseases of aging. In fact, people that study aging call this the slow burn of aging. In fact, there's a term for it now in the aging literature called inflammaging. Inflammation in of itself is a good thing. It's a localized protective tissue response when you injure yourself or you have an infection. That's your body's defense mechanisms. But what happens when the inflammation is uncontrolled and widespread? One of the possible consequences of COVID infection is this loss of control of inflammation that leads to something called acute respiratory distress syndrome, ARDS. And this is the primary issue that is going on in our ICUs right now, directly related to COVID, is that this inflammation and the processes around this inflammation gets out of control. And this is really the thing that is requiring people to become needing a breathing tube. And it's actually the thing that is probably directly causing these deaths. There is something that you have to consider about inflammation and the body's ability to produce energy for its own needs. Inside every one of our cells is a power plant. It's like our own little mini Con Edison. These power plants are called mitochondria. And the thing about these mitochondria is that they are extremely susceptible to damage from inflammation. If our power plants get damaged, the cells don't have energy. If they don't have energy, they can't do the normal things, and then the cells die, and then we get sick. As a result, there is this vicious cycle of inflammation. Inflammation occurs, the mitochondria get damaged. The cells then die because they don't have enough energy. They release chemical messengers and they create more inflammation. And round it goes. And this is the vicious cycle that can happen in diseases of aging, but is especially important in what we are seeing during this COVID crisis. One of the things that you might have heard on the news is one of the comorbidities that makes the COVID outcomes much worse is in patients that have diabetes, and it's specifically type 2 diabetes. Well, in type 2 diabetes, patients generally have a higher level of a hormone called insulin in their bodies. Insulin is the hormone that deals with sugar in the blood. Insulin also promotes inflammation, and inflammation leads to a need for more insulin, which we call insulin resistance. And here you have another vicious cycle. More insulin requires more insulin, requires more insulin. If you look, the diseases of aging, the diseases that we all associate with getting older are almost always associated with inflammation and insulin resistance. Heart disease, strokes, type 2 diabetes, hypertension, obesity, and cancer all of these, if you look at the causative agents, the pathological agents associated with all of these diseases, they all have in common these forces. And it is not surprising that there is a link between COVID mortality and having comorbid any of these diseases. Important to remember. So if we can treat some of these diseases and mitigate some of these problems, we're also going to reduce the mortality rates from this terrible virus. Specifically for things like movement disorders, for example, there is also a link between inflammation. Parkinson's disease in particular has been heavily associated with mitochondrial damage. The power plants inside the cells is heavily implicated in the neuron loss in Parkinson's disease. I'll give you an example. The part of the brain that makes dopamine, which is the part of the brain that is damaged in Parkinson's disease, is particularly vulnerable to something called oxidative stress, which is related to inflammation. The reason why this is occurring is because in order to make dopamine in the brain, you need iron as an ingredient. And what happens with iron when it's left out in the air? It rusts. So in essence, what is happening is that a little portion of your brain is essentially going through the same process as rusting. So Parkinson's disease can be thought of as an accelerated aging of a tiny portion of your brain called the substantia nigra. So it's just like a little part of your brain has gotten a little bit older than the rest of your body. So what are some of the things that we can do to make this better? Well, the first part is eating. And this section is called Treating COVID with a Fork and Knife. So one of the forefathers of modern medicine recognized very early on that one of the most important things we can do to make ourselves healthy is to eat better. He quoted, or he wrote, "Let your food be your medicine and your medicine be your food." Probably nothing else that we do on a daily basis has a bigger impact in our health than what we eat every day. If you think about it, besides breathing, what you put in your mouths is one of the biggest impacts in our biology and our health. It's important to understand that there are essentially 3 different nutrients in all of our foods: protein, fats, and carbohydrates. But there's only 2 of these things that have an essential character to them. There are essential proteins and there are essential fats, which means that your body cannot make these without taking it in from the outside. There is no such thing as an essential carbohydrate. You can make all the carbohydrates you need from protein and fat. As I alluded to earlier, carbohydrates are the biggest stimulator of insulin in the body. The more insulin your body needs leads to more inflammation. The more insulin that your body uses, it results in insulin resistance and the need for more insulin. And more insulin results in these diseases of aging and obesity. This is now the time. If everybody has always thought to themselves, well, gee, I should probably watch what I eat, or take a better watch at what I'm eating. This is the time to start eating cleanly. We have the time now to think about this, and this is a great opportunity to start eating cleanly. Here are some things to avoid and to have a clean diet. Any sort of refined or added sugar, and this includes honey or agave. They are basically sugar in different forms. Starches, especially bread, white potatoes, rice, and pasta. High sugar fruits and vegetables, such as beets, corn, bananas, grapes, and fruit juices. Fruit juices especially are touted as healthy. They're essentially just pure sugar water. Vegetable oils high in omega-6 fatty acids, such as corn oils and canola oils. And anything processed. If it comes in a box, it's probably more processed than is good for you. Some of the things to go for are foods in high omega-3 fatty acids, such as tuna, swordfish, cod, anchovies, and sardines. Foods high in monounsaturated fats, such as olives and olive oil, avocados, macadamia nuts, and pecans. Pasture-raised meats and eggs. High fiber vegetables, broccoli, cauliflower, bok choy, asparagus, Brussels sprouts, and lots of leafy greens. And in moderation, high fiber fruits, blackberries, blueberries, strawberries, and raspberries. People at this time might be thinking, well, a lot of these foods that I recommended are high in cholesterol. People are worried about cholesterol in terms of their health. One thing that people might find very, very important or surprising is that overall, the higher your cholesterol, the lower your chance of dying from all causes, including infections, as we get older. This is surprising. People have been told that cholesterol is something that will kill you. Your whole body is essentially made up of cholesterol. It in of itself is not a boogeyman. And what's very interesting is that, believe it or not, you're higher than your cholesterol, the less likely you're going to die from all causes. And this has been shown in multiple studies. The thing that does get you is inflammation. If you have high inflammation, in addition to high cholesterol, that's the thing that turns cholesterol bad. One way of eating is something that people might have, especially the movement disorder community, is something called the ketogenic diet, which is a high-fat, moderate protein, low carbohydrate diet. And you can see on this pie chart the relative percentages of fat in the around 70%, protein around 25%, and carbohydrate around 10%. People that are on a ketogenic diet tend to reduce their body fat percentage, but more importantly in this environment, they reduce their inflammation and they reduce their insulin resistance. Below is a great and very accessible book that patients can read about this type of diet in general. I want you to be able to see this. And again, this will be up later so that you'll be able to see this. The next section is going to be something called On Nutraceuticals. It's a primer on supplements and vitamins in the COVID-19 crisis. Please, everyone, if they could mute, I'm just going to continue to mute people. Okay. So nutraceuticals are essentially vitamins and supplements that we can take that can reduce inflammation, support your mitochondria, and promote insulin sensitivity in your bodies. During this crisis, I thought long and hard about what would be the top things that I would recommend to friends and family to bolster their immune system in particular. This is a list of the top that I would go with based on as much data that exists in the scientific literature. Vitamin D3, vitamin C, zinc, and two plant-related molecules, quercetin and green tea, which has a very, very fancy name called epigallocatechin gallate, or EGCG, N-Acetyl-Cysteine, and R-lipoic acid. Again, this is going to be up later in PDF form. We'll be able to get this for you, including recommended amounts. So, try to you write it down now if you can, but if you miss something, no worries. We'll get it to you. So there are now many, many different papers in the literature looking at vitamin D3, which is made from cholesterol and is more akin to a hormone in your body than a vitamin. that shows that vitamin D3 is especially important in maintaining respiratory health, preventing and treating infection, and especially in the context of respiratory infections as well. So there's a lot of data that shows that patients with the lower vitamin D3 levels in their bodies are more susceptible to respiratory and respiratory viral illnesses. And when they do in fact get them, they do worse. One recommendation I would make during this crisis is to take 10,000 IU of vitamin D3 per day. Now, 10,000 IU sounds like a lot, but it's only literally under 0.2 milligrams of vitamin D3. People have been given up to 30,000 a day for months at a time without any significant side effects. So this is a very well tolerated dose. I also recommend with patients taking vitamin D3, another vitamin that works together with this quite nicely called vitamin K2, and I recommend 1 to 2 milligrams of K2 with this 10,000 IU of vitamin D3 per day. Vitamin C, everybody since they were kids have been told, drink orange juice, eat oranges, and you won't get a cold. And that did come from some scientific observations. And multiple papers have demonstrated the role of vitamin C in antiviral activities in the body, but it's just not a magic bullet. There needs to be other partners, what you eat, other cofactors to achieve clinical effects. However, right now during this crisis, there are ongoing clinical trials in France and China in this COVID crisis, looking at doing high dose vitamin C to try to manage this crisis. In fact, several New York hospitals are already treating coronavirus patients in the ICU with high dose vitamin C. Based on my reading of the literature, my recommendation to friends and family are try to achieve a 5-gram intake of vitamin C per day. And I say that as tolerated. A lot of people get kind of upset stomachs from vitamin C. Try to take it with food. Not everybody's going to be able to tolerate 5 grams. Don't try to do it all at once. Break it up in 2 or 3 dosages throughout the day. Take it with food, as I said before. And again, this is really a target to shoot for. Some people just can't tolerate it. Zinc. Zinc is another really interesting supplement to be able to take during a viral illness, and especially in this crisis. There are several papers that have demonstrated that zinc salts inhibit viral replication in the body. And this is especially true with respiratory viruses, such as the viruses that cause the flu, the cold, as well as the COVID virus. Now, why would zinc have any, why would chloroquine, which is a drug that people have now seen in the news along with hydroxychloroquine, which is a malaria drug, has gotten a lot of press lately because it's being used now to treat patients with severe COVID. Why should a malaria drug treat this virus that has nothing to do with malaria? Well, it turns out that chloroquine, one of its side abilities is it is something called a zinc ionophore. Now, what does that mean? In very plain language, it promotes zinc entering the cells of our body. So if there's zinc floating around, chloroquine promotes it getting into the cells so that probably the zinc has an ability to interfere with the viral replication. So 2 things that we can do is increase the zinc floating around in our body. And towards that end, I recommend for people during this crisis to take somewhere between 50 and 100 milligrams of zinc supplements per day as tolerated. Again, some people find this a little nauseating, this dose, but try to aim for that intake per day. And if you can shoot for this dose, that would be helpful. And then if you have enough zinc in your body, you want to get it into your cells. So these are 2 chemicals that come from plants. So plants also produce chemicals to fight off infection and viruses. And these chemicals, if we ingest them, we can harness them for our own health. Quercetin is a very, very widespread plant molecule. One of the plants that have the highest amounts of quercetin is, believe it or not, capers. And if you shoot somewhere between 250 and 500 milligrams per day of a supplement with quercetin, that would be a good supplement amount, as well as green tea supplements, specifically EGCG. That's going to be the supplement name. And again, aim for 1 to 2 grams per day. Next is to sort of bolster the body's own anti-inflammatory ability. So the body's ultimate antioxidant and protector of mitochondria is a molecule that we all make every day, and we're constantly regenerating it and using it. It's called glutathione. Now, glutathione would be great to take it orally, but the problem is it doesn't get absorbed very well orally. There are some special oral formulations, but they're very hard to find. Most of the time, in order to get a high enough level of glutathione to make a difference, you need an IV administration, and we certainly don't have that access right now. However, there are supplements that you can take orally that can promote the normal and regenerative metabolism of this ultimate protector of your mitochondria. One of them is something called N-Acetyl-Cysteine. This is something that I recommend patients take approximately 1,200 milligrams per day. The other thing is something called Lipoic acid, which I try to recommend about 500 milligrams per day. Both of these things are geared towards reducing inflammation in a way that does not hobble your immune system. Plus, it also bolsters your mitochondria, two very important molecules in this COVID crisis. This is a summary slide. So if you were to take any picture, this is a great picture to take. These are the top items that I recommend in this environment and their dosages. One thing about green tea is that there's some interactions with Parkinson's meds. They've not been really borne out by studies, but if you find that your meds are not acting quite as what they were by starting to take some of these supplements, green tea, of all the ones that I recommended, may be the one at play. This is a really important section here on stress, helping your body have a strong foundation against COVID. Stress in our lives does one major thing biologically. It increases this chemical called cortisol. And cortisol is normally our body's probably one of our body's strongest controllers of inflammation. But like insulin, if you use a lot of it, it then loses its ability to do what it needs to do. And so if you are under a massive amount of stress, you have all of this cortisol inappropriately circulating in your body, and you end up with a decreased ability to control ongoing inflammation. And remember what I said to you, the thing that's killing people in this COVID crisis is this runaway inflammation that can occur in the severe COVID crises. So how are we going to decrease this cortisol stress reaction when we're being bombarded with so much bad news and so much scary information? How can we protect ourselves? And we can. That's the good news. The first thing is exercise. Now, there's aerobic exercise and then there's resistance training. And they both essentially improve insulin sensitivity and inflammation. But, gee, all of our access to exercise, especially gyms, is closed right now. Well, in terms of aerobic exercise, you can still, under limited circumstances, go out and take a run as long as we maintain social distancing. So you can still go out and take a very mild run. Another exercise that people can Google is something called burpees, B-U-R-P-E-E-S. And this is something that you can do at home that can raise your heart rate, and it's very aerobic. And this is something that is very easy access at home. In terms of resistance training, you can still buy a chin-up bar at home, or buy something called resistance bands. They're very easily accessible by Amazon. They're very relatively inexpensive. They're the two best resistance trainings you can do at home right now. If you Google body weight exercises, your own body can serve as your gym. And there are very easy to follow exercises. If you Google body weight exercises, you can see it's something that anybody can do at home. They're easy resistance training to maintain your muscle during this period. Now, the thing about exercise is more is not better. This is not a time to become an elite athlete. There was a very, very interesting paper from 2019 looking at the role of exercise and how intense it needs to be to help you, and when does that intensity hurt your immune system. And there's a point where too much is actually really bad for your immune system. So a good rule of thumb is to limit sustained exercise, which is generally considered greater than 60% effort, which means 60% of your max heart rate. So you can actually Google how to estimate your maximum heart rate, and there's ways of doing that. It's very easy online. Try to go no more than 60% of your maximum heart rate, and to no more than 60 minutes at a time. Don't go crazy right now. A little bit goes a long way. One of the best ways that we can do and reduce our cortisol is to have healthy sleep. One of the ironic things about being inside and kind of stuck inside and isolated is that people, believe it or not, are now having more opportunities to have better sleep than they ever had before in our busy lives. Well, this is a great opportunity to bolster our immune system. But people never really think about the quality of their sleep. One of the important things that you should be able to sleep in, the room that you sleep in has to be as dark as possible. This is especially hard in cities because we're so used to having something called light pollution, because everywhere we go in a city, there is light. So try to make your bedrooms or wherever you sleep as dark as possible. Taping up windows. And if necessary, you can always buy a very cheap sleep mask online, and this will help decrease the light pollution during your sleep. One thing that you can take is something called melatonin. Melatonin regulates our sleep and wake cycles. It's an over-the-counter supplement. Normally, to do healthy sleep, I generally recommend about 1 milligram per day, about 45 minutes before bed. But in higher dosages, melatonin has very strong anti-inflammatory and immune-boosting capabilities, especially with viral infections. So in this crisis, I recommend to friends and family 10 milligrams of this melatonin 45 minutes before you go to sleep. This is a relatively high dose, but I want people to understand people have been able to take up to 1 gram, which is 100 times greater than this, for months on end without any significant side effects. Probably the most common side effect from this dosage is that you might be groggy in the morning. But if given the other potential benefits from this, I think it's well worth it. Another thing that's something that people, especially in the West, don't really consider, or they have a sort of funny view on, is something called meditation. Every one of us likely has noted that when we're working on something that we really like, or we're engaged in an activity that we particularly like, we have this really wonderful sense of concentration and calm. Some people call this the flow state. Well, it turns out that meditation essentially is a learned process and exercise to sort of voluntarily get yourself into this flow state. It's wonderful for reducing stress. I'm putting up here 3 different web resources that people can go to during this crisis to learn meditation. Transcendental meditation is a form of meditation specifically geared towards Westerners without any spiritual underpinnings per se, tm.org. And then there are these two apps that are recommended to me by experts in meditation that are very accessible to people. And again, great resources to learn meditation when we're all shut in at this time. Meditation is a great thing to do. Think of it as exercise for your brain. I'm going to leave this lastly with just these thoughts. One of the things that kind of we've been bombarded with over the last several weeks is that this is a war against this virus. And I know in this country, we have this tendency to sort of romanticize war, and war we think is a useful analogy. But, you know, if you really think about it, war does more harm than good. You know, war tends to sort of promote desperation, fear, and panic. And I, even as a healthcare, as a doctor, you know, I've had my share of fear and anxiety. And hearing the word war over and over and over again, I think is not the best sort of analogy here. I would rather and you've heard me throughout this presentation, think of this as a crisis. This is a problem. And this is why I call this engineering COVID. We can use our big brains to think and reason our way out of it. In fact, I would argue that our country's greatest moment was not World War II per se, but really putting men on the moon. That was a countrywide effort that we all got together, used our big brains, did an amazing thing, and nobody had to die, nobody had to fear, nobody had to panic. This is a much more, I think, productive and promoting good behavior activity that we can think of at this time. This is our moonshot as a society. This isn't a war. We can't wage a war on an unseen enemy, but we can think and act our way out of this. And I want everybody to really take this message away. We are going to get out of this. This is not the end of us. We are going to get out of this. Life will go back to the way we thought about it. And hopefully we will have learned something that life after this will be even better ultimately. Let's engineer our way out of COVID. So that's what I want to leave you with this, as I now hand this over to my partner, Dr. Gupta. I'm going to unmute her, and she can go ahead and present at this time. Let me just, there we go. And I'm going to present, Fiona, you'll just let me know when to advance your slides, okay?
Thank you. Well, thank you so much, Dr. Kopell. That was just so insightful on so many angles for all of us, and how we can really live well through this crisis. And I really could not agree more. This is not a war. This is a crisis, and we will act and think our way out of this. The reason why this was so important to me was really because of my outreach with the Parkinson's community, and how together we can overcome this COVID-19 crisis. And I think there's a couple of very important points that are very valid for my patients and all patients that are dealing with Parkinson's. Number one, Parkinson's is a very variable condition. Again, there's no two people that are alike, not on this call, not on in my practice, or really in the conglomerate of Parkinson's patients. Everyone is so different. And so it's a very variable condition, but for the most part, patients are not immunocompromised. Patients with Parkinson's are more prone to restrictive lung disease, which is essentially the inability of the lungs to fully expand with air. Patients have more issues with posture, postural changes. You know, shoulders are forward, the neck is hunched. You know, we're all kind of guilty of being on our devices and, you know, having poor posture. But in regards to a Parkinson's patient, that's even more crucial. So patients with postural changes are definitely more prone to having kind of a restrictive lung cavity, as well as some difficulty swallowing. So this is what makes them more susceptible to infection. Protection is vital. Number one, as we always counsel patients on, medication is crucial, not just in what you're taking, the doses you're taking, and how you're taking it, but taking it on time. I know it's a little bit more difficult now that we're, kind of socially distancing and not out and about, and our schedules are often very off, but it's very important if you're at home or wherever you're isolating to make sure those medications are taken on time. Move. As Dr. Kopell mentioned, there's lots of different ways of exercising and moving through this period of time, and that is so essential, especially to really expand those lungs, get the body moving, and avoid any other major issues that go along with being sedentary, especially things like blood clots and edema in the legs and things like that. So move, move, move. Managing other medical issues, as we heard in this wonderful lecture. If you can really manage your diabetes, coronary artery disease, hypertension, things like that, you are going to take a big step forward in really being protective against COVID-19. And then vaccinations for pneumonia and influenza are what we recommend to patients year after year. So making sure that you're staying on top of those. It is important to realize that in the context of Parkinson's, any infection, whether it's a common cold, a urinary infection, or even potentially COVID, are going to worsen the symptoms of Parkinson's disease. And that can include worsening mobility, worsening stiffness, worsening slowness, but many times in the context of infection, things like mental status changes, behavioral changes, even sometimes hallucinations. So it is important to realize if there is an acute worsening of your Parkinson's symptoms, this may be related to infection. Stay vigilant and seek help if the symptoms are to worsen. And it's important to follow all risk reduction guidelines and adhere to the local regulations. Next slide, please. So I see a lot of my patients on the call, which I absolutely love. But for those of you who know me, my mantra of living well with Parkinson's is really sowing the seeds. And when I talk about seeds, as Dr. Kopell mentioned in his lecture, there's a lot of different things you can do to live well with Parkinson's. Sleep is absolutely crucial, as we heard, and it's not just quantity, it's also quality. The exercise component is absolutely crucial, and in my mind, the only thing that will really slow the progression. And again, you can still exercise. What I love about the Parkinson's community is that there are so many proactive groups of exercise, whether it's Big and Loud or LSBT. I'm such a proponent of the Rock Steady boxing, and I was on a bunch of calls with my patients, over the past week who have said, you know what, we can't actually go out, but it's interesting. My Rock Steady group has brought it to me. We're doing virtual exercise programs. We're doing lots of things, via my support group that we can do sort of together, but in a virtual way. So please keep that exercise going. As Dr. Kopell mentioned, you can take a walk outside as long as, social distance is practiced, and lots of other exercises that he gave you the tips for that are available to us, on YouTube and things like that. Eating well, again, I'll reiterate the quote, your food is your medicine, and your medicine is your food. So that is very important. One thing I think we're all guilty of in society, and for my patients who know me, one of the things I always ask on every visit, are you drinking enough water? And I think it's much harder actually when you're not out and about and you don't have that routine and that reminder to really hydrate. But please stay hydrated, drink that water and all those important things. And then the last S in seeds is stress reduction, as we mentioned, that the inflammation and the cortisol, and so important to bring that down. And the socialization. And I know it can be very isolating, especially if you're isolating alone or there's not a lot of community where you are. But virtual meetups, support groups, seek out friends and family, and engage in just regular phone calls. I was on a telehealth call with a patient this morning who said, you know what, I'm going to use this time to go back to my scrapbooking. I'm going to go back to my hobbies. I'm going to really try to, use this time to be proactive and get into things that I like, which I loved. And now we actually have mental health telehealth visits. One of the things I'm the most proud of at Mount Sinai is the team that I work with. And a couple of our providers are providing mental health telehealth visits to patients. And I've already referred quite a few patients to them because it really does make a difference. And so again, those resources are there. Thank you. Next slide. We're all in this together, and again, together we will rise from this smarter and stronger. And again, my patients know my mantra: optimal health is not just being physically well. Optimal health is being physically, mentally, and emotionally well. I have converted probably the vast majority of my practice to telehealth visits, and we can talk a little bit about the logistics into what that takes. But what has really been wonderful is that there's been a relaxation in a lot of the guidelines as to what insurances are covered, or as to state jurisdictions and things like that. So telehealth visits are a wonderful way to stay connected. They're fairly easy to set up, and it really does allow that face-to-face kind of interaction that we may not be able to get without seeing each other in the office. Make sure you have at least a 3-month supply of your medication with refills if applicable. Again, be well stocked. And then for patients who have deep brain stimulation, what's very interesting is that our technology has evolved quite a bit, and there's a lot of capabilities within a patient programmer that can be implemented through self-adjustments. So I can't tell you how many calls this week I've done where I have my patient on the screen, and I'm advising on, why don't we kind of go up on your adjustment or down on your adjustment based on their own device. So that is an option, and the patient programmers do have that capability for self-adjustment. And we'll talk a little bit about if surgery is postponed or batteries replacement is postponed, what you can do. Next slide. So these are the telehealth video visit instructions through Mount Sinai that we give to patients, and it's fairly seamless. As we're all on a Zoom call right now, you can do it through Zoom, but if you have a phone or if you have an iPad, you can actually do it through those as well. So there is a MyChart app, and whether or not we're in this situation, I encourage all of my patients, get that MyChart app. It's a wonderful way to stay in contact with your doctor, to get your results and things like that. So the first step is downloading that MyChart app. Next slide. As well as checking in, and my administrator, we have a lot of great administrators on our team, will actually call you ahead of the appointment to walk through this, to go through each step, so that you're not having to kind of piece out step by step. So we do have that one-on-one sort of capability of setting this up, and again, we're all on Zoom, so we know how to do that. Next slide, please. And so telehealth is a very, very, very viable option. I encourage all patients to use it. Again, I've transitioned the majority of my practice over for the time being, but it allows us to stay in contact, in touch, and you can actually do a very good exam on telehealth. You can kind of get a good feel for how a patient is doing. And again, it can guide us in terms of, what do I need to do with medication or deep brain stimulation? This period of time should not be a pause in your treatment of Parkinson's. We can still be very proactive, and we can still, continue to evolve our treatment paradigms together. And I'm a big proponent, again, in the use of telehealth. So please, if any of you have not done that with your providers, just make sure that you look into the ways that you can. Most providers, particularly movement disorder specialists, are doing that. And just to note on the deep brain stimulation management, one thing that really has come up, again, we are in a center that is very robust, and deep brain stimulation is really our passion and what we do. And unfortunately, given that elective surgeries have had to be put on hold, this might include having a deep brain stimulation battery that needs a replacement. So what happens if the battery does wear down? A couple things. For Parkinson's, I'm working with a couple of my patients. We're adjusting the medication. They're able to go up or down on their stimulator based on my discretion, maybe to preserve battery life. But the key really here is the communication. Next slide. Essential tremor. I have a couple patients who the battery might be waning a little bit. Most patients with essential tremor will turn off at night and turn back on. So we're kind of advocating, periods of time where they may turn off longer. I'm a proponent of using wrist weights and weighted utensils and things like that in the meantime. But this is something we can do, and maybe even to reinstate medication. Next slide. And then if patients do have dystonia and the battery does wane, potentially this could result in a medical emergency or a crisis. And this is, again, where we would discuss with the neurologist and the neurosurgeon, potentially doing emergency surgery, or again, managing it with medication. So I don't want this to be a fear sort of a situation where my battery's draining and what do I do? We have ways of troubleshooting this. And I think that's very important. Thank you. Next slide.
just want to add to that. Again, you know, right now in our health system, we're not able to do most neurostimulator replacements due to the crisis. Although and generally the dystonia patients that do face this issue of dystonic crisis generally are patients with generalized dystonia, not so much the cervical or the focal dystonias. So I don't want all dystonia DBS patients to get worried. But if you know, you keep in close contact with your neurologist, and we will be able to serve you if it comes down to the idea that during this crisis your battery needs to be replaced. I want to reassure people.
Oh, absolutely. And I think, again, Brian, that goes to the communication aspect. Stay in touch. That's the biggest thing.
Okay, so this is our opportunity to answer some of the questions that have been submitted. Let me first start off by saying this hopefully will be the first of a series that we do. I'm going to start my video so that people can see. This is going to be a first of a series that we will do. After this is done, you will see this edited presentation posted on Facebook, Instagram, and Twitter in those areas that we posted at the beginning of this presentation. If you submit a question that we don't have answered, we will do our best to get you an answer or a consult via telemedicine. So I'm just going to answer some of the first initial questions. Can you provide a PDF of foods to eat and avoid? So I did put a limited list. The book about low carbohydrate living is also a great resource. And that was available, and that will be available later in terms of the presentation that you'll be able to see, so no worries about that. Question was, does the keto diet help with Lewy body dementia? So there's actually an emerging body of literature looking at the ketogenic diet in neurodegenerative illness, Alzheimer's, Parkinson's, and Lewy body dementias. And so far, the studies are small, but there's some promising data that is coming out regarding this. So patients that are having neurodegenerative illnesses, there is a good reason to eat the ketogenic diet in general.
Yeah, and I have to agree, Brian, especially what you presented with the keto diet and inflammation, right? Any type of neurodegenerative disease, I believe, is going to be better served with a less inflammatory diet.
So you know, people often Gary Heil actually put a question. I was glad somebody did. This diet discussed was heavy in fat and proteins. Don't these block absorption of levodopa? So look, certain co-administration of protein and dopaminergic medication can be problematic, but in general, that can be managed by timing of the medications. And one of the things that I see in my Parkinson's patients is that they have a lot of muscle wasting because what they hear is don't eat protein. Well, if you don't eat protein, you can't maintain your lean body mass. And if you can't maintain your lean body mass, you can't be healthy. So there's a way to time your medications where this is not an issue, full stop. Melatonin is safe with patients with Parkinson's. It will not interfere with your PD meds. That doesn't bear itself out with investigation. Again, a copy of these slides will be presented later on, so people can get that if they email that email, movementquestions2020@gmail.com. So that's an opportunity there for that as well. Here we have, and again, we have an opportunity now. If people want to shoot us questions, this is the time to do this. I do hope that this was at least empowering in some way that makes people feel a little less scared, a little bit more of a sense that people do actually have control over this crisis. This is not, again, not some unseen enemy that we have no ability to control. There are going to be very, very tough times ahead. I don't want to downplay that. You're going to see some really what appears to be disturbing numbers, but it's really, really important to put these numbers in context of the overall population and who is really asymptomatic and not getting sick, and Unfortunately, that may not be well telegraphed in the media because it doesn't make great copy, but I want people to understand that. This is not the end of the earth. This isn't a Stephen King novel. We're going to get through this. We're going to get through this. Looking at the chat box to see if there are any questions.
I think it's the ibuprofen Advil question, Brian.
Yeah, that's right. So people, ask me about, clearly right now there's some emerging data about ibuprofen or Advil that has been found to have a increased link with a bad outcome or death with COVID. And so people are being recommended to stay away from Advil or ibuprofen or Motrin. The question was, can I take any other NSAID? The answer is we probably don't know. And my recommendation to friends and family is, since most NSAIDs work the exact same way with probably the exception of aspirin, to continue not do any NSAIDs. Do not, probably stay away from all NSAIDs at this time, assuming that they are probably related to that issue with ibuprofen. But I want you to reach out to your own doctor to make that final call. My dad is pretty stubborn about drinking water. What are some other options to help with hydration? I like iced tea. Iced tea is great. You can either do iced black teas or iced green teas. Great alternative to.
I think the green tea would address a lot of the nutraceuticals that we would like. I think that's fine. But really, there is no substitute for water. You can flavor the water by some of the powders, but again, stay away from the fruit juices. Stay away from any of the heavy, carbonated beverages and things like that. So no substitute to water.
Somebody asked, can K2 be taken with those with MTHFR gene modification? This is a gene. This is a gene that encodes a certain enzyme that methylates certain cofactors related to folate production. I'm also one of the gene copies. Yes, in essence, you can take K2. I know that there are some questions about that, but taking K2 even in that context is perfectly safe. Does drinking alcohol affect medicine results? Well, in general, drinking alcohol reduces your immune system, and during this crisis, I would say, is a good time to sort of reduce your alcohol consumption as well. What is a cough medicine that you can take with an MAO inhibitor? That's a really good question.
Right. So any of the cough medicines that have the DM, the dextromethorphan, you're going to see on the label, this may be contraindicated in Parkinson's, and that's specifically for patients on an MAOB inhibitor. So I do recommend to my patients anything without the DM. You can get Mucinex without the DM or the Robitussin even without the DM.
A good follow-up question, if you're using Duopa, how can you schedule protein intake? This is a good question. There's an answer to it. It's more complicated than I can present here. It's something that I would recommend that you have a telemedicine consult with your movement disorder neurologist, or you can make one with the resources that we put forth in the Sinai system, and we can help you with that issue.
Yeah. And Brian, there's a couple questions about which Facebook group this PDF will be posted to. So
okay, I'm going to go back to that in a minute. Hold on. Let me. I'm going to show the different ones in the beginning of this. Okay, there we go. So this is the social media and the questions. This is where it's going to be posted. There are 2 Facebook pages. There's an Instagram and a Twitter handle or feed, rather.
Yes, and we'll be monitoring that email as well. So if there's any other questions that come up, or any type of kind of personal issues related to your health, you can always email us and we can give you the best resources.
All right. Well, if there are no other questions, I think at this time we're going to bid you all good health Stay healthy, stay safe, stay inside, wash your hands, don't touch your face.
And we're all in this
And,
together. Yes.
And like
Communicate.
I said, we can engineer our way out of this. We're going to engineer our way out of this. You're going to be all, you all can be a part of it. Okay. There are some questions. I just say, give me a moment. I've got a couple more questions. You said a higher cholesterol can be good. How does this relate to high triglycerides? So that's a really great question. As I said to you, higher cholesterol does not appear to really be a biomarker of health. More and more data is coming out that shows that high cholesterol, whatever that means, is not the bugaboo that we thought it was. Conversely, high triglycerides, which is a fat byproduct in your blood, is in fact a good biomarker of insulin resistance and health. And one of the ironic thing is, while that triglyceride levels in your blood are not really the result of eating fat, they're the result of eating excess carbohydrates or sugars. Triglycerides are primarily made by your liver as a result of eating an excess of carbohydrates. So I want people to understand that. That is a biomarker. If I am prone to autoimmunity, is it safe to take all the nutraceuticals? Can I rev up the immune systems too much? None of these are directly related to goosing the immune system. It's just to bolster the normal immune system. So I have not read any of these supplements as being problematic in an autoimmune situation. But again, I'm going to let you discuss that with your own rheumatologist. You want to recommend any recommendations on balancing hormones with PD? That is another great question, something that you can reach out to Fiona Gupta with via telemedicine. It's going to be probably a subject of a future presentation.
Absolutely.
Yes,
yeah.
There is absolutely things that can be done, but again, outside the scope of this particular, outside the specific presentation. If you want another topic, one of my colleagues in neurosurgery, Leslie Schlachter, has a very active a Twitter account at Brainy Leslie, BrainYLESLIE, or at Fiona Gupta. These are Instagram feeds that you can request additional topics for future presentations.
Great.
Okay. All right. Again, we're just making sure that we get to everybody's questions. I think this is it for now. I'm just checking on my support staff here to see if there's any questions. One last call for questions. All right. I think we're it. All right. Be well, everyone. Okay.
Thank you.
We'll talk soon. Okay. Take care.
Be well. Be well.